Okay, then let's begin our class. Okay, I have, as already introduced, my name is Noman Shahid. I'll be teaching you stomatology. And today is the first slide, Introduction to Stomatology. If you have any question, I again ask you, you can ask me freely regarding the subject. And if I go fast, if I speak fast, you can, someone can let me know that I need to slow down, okay? So, definition of stomatology, we'll start with the definition. Dentistry, also known as dental medicine and oral medicine, is the branch of medicine focused on teeth, gums, and mouth. It consists of the study, diagnosis, prevention, management, and treatment of diseases, disorders, and conditions of mouth, most commonly focused on dentition, which is the development and arrangement of teeth. Here, dentition means the development and arrangement of teeth, as well as the oral mucosa. So in usually all over the world, we use this term for oral medicine: dentistry, dental doctor, or a dentist, oral doctor, like that. But stomatology is a branch of medicine, or we should say dentistry, which is concerned with structures, function, and disease of mouth. It is particularly used to study anatomy, physiology, and disease of the mouth. Okay, this is also known as oral medicine, dental medicine, and maxillofacial medicine. So you can say stomatology is a sub branch of dentistry, but in some part of world, stomatology is considered itself as dentistry. But majority of the countries, they use dentistry or as a dentist for the term of or for oral medicine. Okay. Pierre Fauchard, 1679 to 1761, was a French physician who was the father of modern dentistry. So he is the father of modern dentistry. He is widely known for writing the first complete scientific description of dentistry, The Surgeon Dentist, published in 1728. He published this first book explaining a lot of things about oral anatomy and function. His book described basic oral anatomy and function, signs and symptoms of oral pathology, operative method for removing decay and restoring teeth, periodontal diseases, paria, orthodontics, replacement of missing teeth, and tooth transplantation. He described all of this in his book, The Surgeon Dentist, which is in French language. Okay, so this is the stomatology syllabus we'll be covering this semester. These are the topics. Usually it's mostly almost same as what I have been taught, and this is more than enough for a medical student or a student of MBBS to be taught for this subject, because we are not dentists and we are related to medicine and surgery. So syllabus include about the anatomy of oral cavity, tongue, and palate. First, we'll be starting with the anatomy of oral cavity, tongue, and palate. Then we go for the dental anatomy, the structure and the function of teeth itself. And then after that, before going to the diseases part, we will learn how to take a dental history, perform examination. Of course, the major part of the dental history is same as other subjects, other history taking skills, but then there is an additional part or history taking technique which is used in this field. So a lot of, when you will go to the hospital, a lot of people will come to surgeons or medicine, internal medicine department, that they have a toothache, they have caries, and then you can refer them to the dentist. Or sometimes you will find abscess ulcer, which are usually related to other diseases, or oral infections which are also related to other diseases. So it's good for the relation, and maybe you can also help them, these patients, a lot. So we'll start how to take dental history and perform an examination, especially dental examination. What are dental caries? How cavities are formed? Then we'll go for the common oral infections caused by aerobe and anaerobe bacteria. What is aphthous ulcer? Aphthous ulcer is an important topic, usually idiopathic, but it is related to the teeth somehow. So we'll study here. What are periodontal diseases, which gingiva or gingivitis, these caused by these? What are the common pre-malignant lesions? As you all know, in the end of every subject, there are pre-malignant lesions, and then finally the malignant tumors. So it starts with the anatomy and physiology, goes to the history, then the common diseases, including microbiology intervention like viral infections, bacterial infections. Then we finally go to the pre-malignant lesions like benign lesions or some tumors which are non-cancerous, and then we finally go for the malignant tumors. Okay, so today our topic is anatomy of the oral cavity, tongue, and palate. So let's start with the anatomy of oral cavity. So as you can see, this is the oral cavity, and it extends from the lips to the oropharyngeal isthmus or opening or neck, right? And is subdivided into vestibule and oral cavity proper. So the oral cavity is extended from the lips and it goes to the oropharyngeal isthmus and is subdivided into two parts, vestibule and oral cavity proper. Now let's see, the oropharyngeal isthmus is the junction of the mouth and pharynx. So this opening you can see where the mouth ends and the pharynx starts, this juncture or opening, which is created by these structures, superficially by the palate, soft palate, laterally by the fossas or pillars or the palatoglossal folds, and the floor is made by the tongue, or we should say the root or base of the tongue, which is cannot see here, is posteriorly present. So this whole makes isthmus or opening known as oropharyngeal isthmus, because it connects the oral cavity with the pharynx. That's why it's known as oropharyngeal. Okay, what is the importance, clinical importance of this isthmus is there are many lymph nodes, group of lymph nodes present, Wilder rings, and then palatine dorsals, right? A lot of lymphoid organs are present in this. So this is the clinical significance of this isthmus. Is bounded by, as I told you, above by the soft palate, because as you know, anteriorly in the front there is hard palate, and posteriorly on the roof of the mouth is soft palate, and whereas uvula also hangs from the soft palate. So the uvula is a part of soft palate. So above by the soft palate and the palatoglossal folds. These palatoglossal folds are present on anterior-laterally. They are joined from the, they are originated from the anterior and they are present on the posterior lateral walls. Okay, and below by the dorsum of tongue. So as you see, this part of the tongue is the dorsum of the tongue, and when you elevate your tongue, the part behind is ventral. So this part you can see is the dorsum of the tongue. So previously we have heard vestibule and oral cavity proper. Now we go for the vestibule. What is vestibule? It's a slit-like space. So it is a space between the cheeks and the gums. So here, if you can see in this picture, this diagram, so you can see oral vestibule is this slit-like part. So it is between the gums interiorly and exteriorly to the inner, or I should say medial mucosa of the buccinator muscle, right? Or cheek muscle. This is buccinator muscle, is also known as cheek muscle. It communicates with the exterior through the oral fissure. So if we go anteriorly towards lip side, this slit, oral vestibule, if we go towards interiorly, it is closed or communicated by the oral fissure and it goes up to the lips. So this all space in between the lips and the gums and the teeth closed, this all slit like space, this space is basically vestibule, oral vestibule. And when the jaws are closed, it communicates with the oral cavity proper behind the third molar tooth on each side. For example, so previously we have gone anterior to the lips, right? If you go to the posterior, if your jaws are closed posteriorly, they connect to the oral cavity proper, which is behind the, above the tongue and behind this area. So basically, when you close your mouth, inside the cavity is formed, right? The cavity anterior to the pharynx, anterior to the oropharyngeal isthmus is oral cavity proper. Okay, now the lateral wall of the vestibule is formed by the cheek. So this lateral wall of the vestibule is formed by the cheek. The cheek is composed of buccinator muscle or cheek muscle. So it is one of the important muscle of the cheek, covered laterally by the skin and medially by the mucous membrane. So laterally means exteriorly to this cheek or the lateral wall of the vestibule or the cheek. Laterally it is skin and interiorly by mucous membrane. A small papilla. What is papilla? An opening of a duct on the mucosa opposite to second upper molar tooth, upper second molar tooth. So if you see here, this is upper second molar tooth, upper side second molar, and opposite to that on the mucosa there is a small papilla or opening of a duct, which marks the opening of the duct of parotid gland, also known as parotid papilla. So this is the parotid papilla, and this is duct of the parotid gland. This is an important landmark, an important anatomical landmark. Okay, so now we go for the oral cavity proper. So this, as it says cavity, it is a cavity within the alveolar margins of the maxilla and the mandible. As you know, the maxilla and mandible are the bones where teeth are attached, or basically these are teeth sockets, right? So maxilla is upper bone, upper jawbone, and the mandible is the lower jawbone. Okay, so when you close your mouth, inside these bones or teeth, whatever the cavity is formed up to the oropharyngeal isthmus is your oral cavity proper. As we already know, have discussed, the roof of the oral cavity is made anteriorly by the hard palate and posteriorly by the soft palate. So if you look at the roof, anteriorly it is formed by the hard palate and posteriorly the soft palate, and from the soft palate uvula is also hanging. Okay, the floor of oral cavity. If we talk about floor of oral cavity, we say its floor is formed by the mylohyoid muscle. It's not seen here, it's below the tongue, and the anterior 2/3 of the tongue lies on the floor. So the floor of the oral cavity proper is formed by a muscle. This is the second muscle we are learning, mylohyoid. Right? Why it comes with this mylohyoid? Because it is attached to the hyoid bone. We will see it later. And this muscle, upon this, our tongue, how much part? 2/3 of the tongue lies on this floor, and 1/3, the base and the root is present posteriorly. The uvula hangs downwards from the soft palate, as we have known the hard palate, soft palate, and then from soft palate, the uvula is formed, and the lateral walls or fosses or pillars are formed, which has platoglossal arch. This is known as platoglossal arch. Inside this or medial to this are palatine tonsils, and medial to this are platopharyngeal arch. Okay, here again, this is the lateral view, or this is hard palate, more bony, soft palate, uvula, oropharynx, and this opening basically here is oropharyngeal isthmus, and this is the inner surface of the lips. Here we can see again anterior pillars containing palatine tonsils, platoglossal arches, fossets, and terminal sulcus. Okay, we'll study there later. Okay, the floor of the mouth. So we start with the vestibule, the oral cavity proper. Now we go for the floor of the mouth. So the floor of the mouth is covered with the mucous membrane. As you already know, below the tongue, there is mylohyoid muscle, and the anterior two-thirds of the tongue is lied on that mylohyoid muscle. Okay, this is covered by the mucous membrane. In the midline, a mucosal fold called the frenulum or frenulum linguae connects to the tongue to the floor of the mouth. So you see here in the midsection, this is the ventral surface of the tongue. Dorsal surface we cannot see here, right? So this is the ventral. When you elevate your tongue towards the uvula or towards the palate, you can see the ventral surface of the tongue. Excuse me. So the ventral surface of the tongue has a mucosal fold, which is seen in the midline. So this is known as frenulum linguae or lingual frenulum. And this connects your tongue from the ventral surface to the floor of the mouth, right? On each side of the frenulum, you can see a small papilla opening, has the opening of the duct of submandibular gland. So these openings, as is demarcated here, are the duct of submandibular gland. Now, lateral to these, you can see sublingual papilla. Lateral to these are rounded ridge extending backwards and laterally. So a rounded ridge extended backwards and laterally from the papilla, from this submandibular gland, duct of submandibular gland, is lateral ridge, which is extend laterally and towards the backwards. Okay, this rounded ridge is produced by the sublingual gland. So we have discussed up to here 3 glands and their papilla. So one is submandibular on the lateral sides of the frenulum. Then there is sublingual gland, which is on the lateral side of the submandibular gland, which forms a rounded ridge, extends laterally and posteriorly or backwards. And the third one was parotid papilla, remember, which is opposite to the upper second molar tooth, is called parotid papilla. Okay. Okay, finally, we go for the nerve supply. So nerve supply is divided into 2 parts, sensory and motor. Okay, up to this part, does anyone has a question? If I have a question, you can turn your mic on and ask. Has it started?
Yes, sir.
Okay, so again, let me repeat the last slide. The floor of the mouth, covered by mucous membrane. Okay, covered by mucous membrane, has tongue, and below that there is mylohyoid muscle. The anterior 2/3 of the tongue is present on the mylohyoid muscle itself, and the posterior 1/3, the base and the root of the tongue, is present on the pharyngeal side. Midline, we saw a frenulum, also known as frenulum linguale. Okay, and then below that, towards the inferior side, on the both sides, there's a duct of submandibular gland, and the lateral to that, a round ridge is extending laterally and downward or backwards or posteriorly, which is sublingual gland. So now the nerve supply, the most important part and my most favorite part, nerve supply of tongue or the oral cavity, basically. Because tongue also have taste buds, also have sensory, motor, right? So we will study that in later slides. So nerve supply, sensory nerve supply and motor nerve supply. Sensory to the roof, to the floor and the cheek. Okay, to the roof by greater palatine and nasopalatine nerves, which are the branches of the maxillary nerve. And floor and cheek are basically supplied by the mandibular nerve. Floor because it has tongue, lingual nerve, and cheek because it has buccinator, buccal. So it is buccal nerve. So how to remember these? Always try to remember arteries and veins and nerve supply as much as you can and try to find a mnemonic. So that's why I have changed this color to green, the maxillary nerve, and the red to mandibular. As you know, the roof has palate, right? Soft palate and hard palate, and interior to that, What is the bone? What is the jawbone? It is maxilla. So that's how you remember it is from the maxillary nerve. And because it has palate and nose on the upper side, so greater palatine and nasopalatine nerves. That's how you remember. And as you know, the floor has anterior to that a jawbone, which is known as mandible. That's why, and the cheeks are also extended, lateral extension of that jawbone. The cheeks are formed on the muscles which are present on the outer side of the mandible. So these are supplied by the mandibular nerve. The floor has lingua, has tongue, so it is supplied by the lingual nerve, and the cheek has a buccinator muscle which forms the buccal cavity, so it is buccal nerve. That's how you remember. Okay. Motor. What is motor? Motor is for movement, right? And the muscle responsible for movement here in this oral cavity, there are two muscles: cheek, buccinator, and the lip, orbicularis oris, right? These are supplied by the facial nerve, right? The cranial nerve. So motor innervation is by the facial nerve, which is to the muscles. Two important muscles are shown here: buccinator, cheek muscle, and lip, orbicularis oris, right? Now we go to the nerve supply. See here. Okay. So for the tongue or the oral cavity, so these are the anatomical structures here. These are the taste. As you see, this is glossopharyngeal nerve, chordotympanoid nerve, and the nucleus, hypoglossal nerve here. So you can see, you can appreciate all the nerves and their innervations. What we have studied is this nasopalatine nerve, greater palatine, lesser palatine. So nasopalatine and palatine nerves. So these greater palatine and lesser palatine are palatine nerves. So this is innervated by the maxillary nerve, right? And below this is mandible. So this lingual part or the tongue will be innervated by the lingual nerve, and the buccinator muscle will be by buccal nerve. Okay. So next, after going to the oral cavity, the anatomy of the oral cavity, we'll go for the anatomy of the tongue. So the tongue is basically a mass of striated muscles, right? Covered with the mucous membrane. As you know, the muscle types: striated, non-striated, right? Cardiac, nervous. Okay, so tissues and muscles, right? So these are the muscles which are striated, covered with the mucous membrane. I'm talking about the tongue. It's divided into right and left halves by a median septum. If you see it anteriorly, the dorsums of the tongue, the dorsal surface, you can see a midline groove overlying the lingual septum. This groove is known as median septum, and the groove is known as midline groove. So three parts, the tongue has three parts. Anterior 2/3 on the mylohyoid muscle, as we know, is the oral part of the tongue. Then behind that, towards the pharynx, is the pharyngeal part, posterior 1/3 of the tongue. And at the lower bottom, then there starts the base with the root. Why it is root? Because the tongue is attached to the bones and here in the root part. And it has two surfaces, dorsal and ventral. Okay, so this is the dorsal surface. So let me repeat again. The tongue is a striated mass of striated muscles covered by mucous membrane. It's divided into two halves, right and left halves, and it is divided by median septum. Three parts of tongue: oral, pharyngeal, and base, including the root, and two surfaces. Three parts and two surfaces: dorsal and ventral surface. Okay, here first we study the dorsal surface of the tongue. So as you can see, it's a huge structure divided into anterior 2/3, known as oral part, oral tongue, and posterior 1/3, known as pharyngeal part of the tongue, and is divided by a V-shaped sulcus. As you can appreciate in this diagram, there's a V shape. So this V shape, posterior to that is post sulcal part, posterior part, also known as pharyngeal tongue, pharyngeal part of the tongue. Posterior 1/3 and anterior 2/3 is the anterior part or pre-sulcal. So this is the sulcus. Anterior to that is pre-sulcus and posterior to that is post-sulcus, and divided by a V-shaped sulcus. This sulcus is known as sulcus terminalis or terminal sulcus. Why it is known as terminal? The tongue is not ended, right? But terminal in terms of this papilla, because the papilla after this they are not differentiated papillas. So that's why they name this sulcus or ridge or boundary as a terminal. So all the papilla, which includes the taste buds, are found in the anterior 2/3. Okay, now we go to the apex. Apex means the tip. The tip, the apex of the sulcus faces towards the marked by the pit called the foramen cecum. Not the apex of the tongue, the apex of the sulcus. So these are the boundaries, and this is the apex. This apex faces backwards of the tongue. So we're talking about V-shaped sulcus. This is the apex and this is the base. So apex is marked backwards and it is towards a pit. This pit is known as foramen cecum. You remember foramen cecum from the embryology? It is the embryological remnant. So foramen cecum is an embryological remnant marked by the site of the end of the upper end of the thyroglossal duct. So this foramen cecum, the thyroglossal duct, during the embryological development, it degenerates and forms the thyroglossal duct, and then it degenerates to form foramen cecum. And this foramen cecum is basically the upper end of the thyroglossal duct. So in some of the patients, we also see the remnants, or we should say persistent thyroglossal duct. This is a disease which we study in ENT, ear, nose, and throat. So there, some patients have a persistent thyroglossal duct, and is because of the embryological defect. And in that patients, you cannot see foramen cecum because it's not degenerated normally. Okay, so this is about the dorsal surface of the tongue. Other than that, palatoglossal arch, lingual tonsils, palatine tonsils. These are still the arches. These are all arches, and these has muscle, platopharyngeus, and then lymphoid nodules of lingual tonsils, and then there is epiglottis. Okay, so anterior 2/3 of the dorsal surface of the tongue is the mucosa is rough. This mucosal membrane is rough and shows 3 types of papilla. We are talking about the anterior 2/3 of the dorsal surface of the tongue. So it has 3 types of papilla and the surface, and that's why the mucosa is rough. Fungiform or fungiform, however you want to pronounce, filiform, and velat. Okay, so these are filiform. We'll see the structure of these. So fungiform, filiform are usually in the center, fungiform on the tip and the sides, and velat. And because they are circle in the form of round, so sometimes they're also known as circumvelat. So these are the papilla, and because they are present on the tongue, they are known as lingual papilla. Other than that, posterior 1/3, no papilla, but shows nodular surface because of underlying lymphatic nodules, which are known as the lingual tonsils. So you see on the right and left, these are the lingual tonsils. And what are these? These are the lymphoid nodules of lingual tonsils. These are the nodules and these are lingual tonsils. Posterior 1/3 of the tongue, there are no papilla found there. One more papilla, which is the foliate papilla. These on the lateral posterior, or you should say posterior lateral aspect of the tongue, are found. These papilla are known as foliate papilla. Okay, now here you can also appreciate the dorsal surface of the tongue. If you can see apex, body, root of the tongue on the left side, this is the dorsum of the tongue. Inferior surface of the tongue or ventral surface, this is the median section. And now if the sphere view of the dorsum of the tongue is the same as previously. Lingual papilla, So this is anterior part, pre-sulcus part, posterior part or post-sulcus part. This is the V-shaped sulcus. V-shaped sulcus has an apex. This apex backwards points to a structure known as foramen cecum, is the remnant of the embryological upper end of the thyroglossal duct. So behind this posteriorly is lingual tonsil on the left and right side, which has lymphoid nodules of lingual tonsils. Behind that, there's epiglottis. Lateral walls initially are formed by the platoglossal arch containing palatine tonsils. These lingual papilla are, because they are present on the tongue anterior to third, that's why they are known as lingual papilla. And there are three types on the anterior surface, one posterolateral, and the post-sulcus or lingual tonsils don't have any papilla. This is the dorsal of the tongue. So here we go for a break.